Hello, and how are you? My name is Winnie Barawa. Welcome to our session on principles of school health programs. If you're new here, this is a channel that focuses on lectures, lessons, and interviews pertaining healthcare. And if you wish to learn more about us, don't forget to subscribe. If you're a returning subscriber, thank you so much for being with us. So, without wasting much time, let's dwell in and see what is there for us today. So, under principles of school health program, we are going to evaluate the issues or aspects that guide us when we are developing the school health programs. So, it's therefore important that at least we learn on these principles and how best to apply them when you're developing the school health program. And one of them that you can look on is that whatever school health initiative that one is looking into needs to be based on the health needs of the children. Now, there's a video we've handled that looks into health needs of school-going children, and it's looking at the different needs that children have as they go to school. So, most of these health programs they are based on such needs. The second one is we need to plan the school health program based in coordination with school health personnel, parents, and community. Like you cannot do a school health program without involving the team that is part and parcel of the school. Now, a school health program, you don't work alone, you work with a team. And in the previous lessons, we just looked at the team members of all these programs. And there are many. Now, based on the needs that you've established for the school, then you need to look into which personnel or which health team member can I involved in my discussion pertaining this particular initiative. So you plan this with coordination with that particular team member that is key for implementation of the project. It could be maybe you need the parent, you need the teachers themselves, or you may just be needing the students only. And then the other principle is emphasizing on health education. As much as we want to have interventional projects in the school, we are told that most health initiatives that are targeting schools should target on behavior change. And to have behavior change, you need to emphasize more on health education because number one, this will help us to promote, protect, and improve on the health of the children and the staff. With health education, also, it leads more into informed decisions so you can create more awareness that can easily like shift the behaviors of our students and promote like informed decision for that purpose. Okay, and the other principle that is on principle number 4, then you can check on emphasizing on promotive and prevention aspect. So remember, as much as you want to treat illnesses, that should not be the main approach to school health because you don't want to be having sick children in your school or you don't want to always be working with medications and creative interventions. The best approach for school program is the health promotion and health prevention. And for this, then there's emphasis more on promotive and preventive aspect. For example, in the case of behavior, then most aspects will want to see that at least when you're intervening on the children, then there's an aspect that whatever was done, there was a preventive aspect that was done before. Then the other part is emphasizing active and desirable participation. You want children to be active in this as project. You want the team members of the school health program also to be active in in the activities. The program should be also ongoing and a continuous program, should not be an intermittent program. However, with the monitoring and evaluation approach, sometimes you may have short-term programs, sometimes you might have long-term programs, but it should be at no given time be whereby a school has no health program at all. And health program means we are not saying an active intervention that is ongoing, but even should be present in the policies or should be present in the daily activities of the children, can be presented in the curriculums or on the weekly timetable of the school. And lastly, it has effective system of record keeping and reporting. Let there be tools that show logical frameworks or shows the action plans of the school pertaining to health. So should the school have an effective system of record keeping and reporting, showing the progress of the school when it comes to implementations pertaining to school health initiatives. And all these are different ways on how the school can show that they have been working on school health initiatives, school health projects, or they have anchored their school health programs in the school curriculum and events. Here we have our references that you can read more on. We can only use the WHO guideline for the school health services. You can also use the national school health policies, and you can have more links as above that you can read or refer to when you need more principles to read about. And thank you so much for being with me to the end. If this is your content that you like, kindly remember to subscribe. Also, you can comment, but you can share also the lessons with your friends or colleagues that can join our community. Thank you, and see you in our next class.